Tonight, the presentation is supported by Kettenbach, and I'm here as a wet-handed dentist that practices full-time doing general dentistry to share some exciting news. I've been using Kettenbach's product for approximately the last year and a half, and I really believe it, and I think it's something that you're going to believe after you listen to my presentation today. So a little bit about me. I've been practicing for 30 years. I have a degree in aesthetics, and I'm accredited through the American Academy of Cosmetic Dentistry. I place a lot of implants. I have diplomat status with the ICOI, and I teach at the Coy Center. I'm currently writing a book about ins and outs of dentistry for the consumer, so I look forward to being able to share that with you soon. When we're dealing with dentistry day in and day out, certainly we are concerned about golden rules of proportion. And we know all of these rules through nature, through Da Vinci, through all the historical construction and art. And we find it in engineering, we find it in clothes, and certainly we find it in human form. So this is nothing that is foreign to us as dentists. If you go to have a nose job, it's not foreign to a plastic surgeon either, because they're not going to just indiscriminately say when you come in and you say you want a nose job, they're going to go ahead and do some golden rules of proportion themselves, take some measurements, and decide why, in your opinion, your nose is off. Where are the golden proportions being violated? We follow this rule in dentistry as well, of course. 1.618 to 1 is our golden rule of proportion. And as we move forward, there might be many ways that, there are a number of ways for us to assess this. Certainly we could use those metal forceps, calipers, the golden rule calipers. We can use simple tabs like this. And practicing for 30 years, I'm sure you too have a feel for golden rules of proportion. You can look at a smile and understand if they're too chiclety, if they're too short. As we move forward, our goal as dentists is to envision a smile and be able to quickly treatment plan. And I really feel that as dentistry is becoming more and more group practice and more driven by corporate, we got to know where we're going, and we got to know how to get there quicker. And getting there quicker is the key, because unless we can get there quicker, we're not going to be profitable. So first of all, you got to know where you're going. You got to know how to envision a smile. And secondly, you got to be able to get there quick, right? And so let's talk about envisioning a smile. I just want to share a couple quick pics so you can understand what ViSalus Veneers can do for you. This gal came in just a couple months ago, referred by an existing patient. Her daughter, my existing patient's daughter, lives in Chicago. I'm in Detroit. Gal, mom sent a pic on her iPhone. Can you help my daughter? We're having a family wedding. Took a quick look at that, and certainly I knew that I wanted to do some crown lengthening on number 7. And of course, mom's paying the bill and daughter is young. What are my options? I can bond 7 and 10 by hand. Certainly that's an option. I can place lab fabricated veneers. Certainly that's an option. And until now, those were truthfully my only 2 options. But now with ViSalus Veneers, in a day, the same day, 1 appointment, I can place porcelain, I can place porcelain veneers on these 2 teeth that I believe creates even a stronger end solution, a stronger end product than a porcelain veneer lab fabricated. So after the crown lengthening was completed, in 1 appointment I was able to go from that to this. And I think that's a fabulous result for this gal at a minimal cost, with only 1 appointment invested. Here's another good example. Like I said, this product is very versatile, and I found myself 3 times this week already using it. This product can be used for a situation like, how are we going to restore this implant? How are we going to provisionalize this implanted tooth? The patient doesn't want something that's removable. I place my implant, and in the same day, I'm able to take a size measurement with the guide that Visalis provides, choose a veneer for provisionalization, and immediately be able to bond it in place. What a wonderful solution for the patient as well as myself. And I still have access from the lingual if I need it. So those are just two quick examples of how Visalis is used on a daily basis, and I believe it's a tool that should be in all of our toolboxes. So what are some first steps? Let's take a look at some smile previewing and some techniques for smile previewing. And what I mean by that is, how are we going to preview smiles for our patients? What are the tools in our toolbox for previewing a smile? Well, first of all, we can take some old composite from our drawer and simply build up on the existing teeth without bonding composite. Just tack it onto the front of the existing teeth to show a patient, as you can see in the first photo in the top left, when the patient is resting their lips, we call this a repose position. The patient is resting their lips. This 29-year-old female doesn't even have teeth that are visible in her smile at rest. So you can see that this first pic is showing a 29-year-old that looks like a 60-year-old. One of my first goals is to be able to visualize for this patient in her mouth what a smile design would look like. So I can take some old composite and just build it up on the teeth to get an idea for myself and for the patient how much bonding is necessary, or just previewing a smile, where I want to go next. And like I said in the beginning, the quicker I can do this, the more profitable I'm going to be. So having tools in my toolbox to get to end game quicker is key, wouldn't you say? So one of the possible ways to preview is simply putting composite bonding on the tooth. The second might be to digitally image. However, this technique doesn't allow me the ability to see a smile in repose, and I believe that's one of the most important steps in having a perfect outcome. It would be a shame to veneer someone's teeth, bond someone's teeth, and still not see a smile when the lip is at rest, not see teeth when the lip is at rest. So this digital imaging for me doesn't function for me to see the length of the desired teeth. It might be helpful to see some buccal corridor and just simply to start the process of building the patient's expectations or showing the patient what you can do. But as far as understanding the ideal length of the tooth, this wouldn't be my first choice. Next option, certainly we could complete a diagnostic wax up and retrofit some resin along over the top of the teeth, as long as the case is an additive case. And the fourth technique that I use in my practice is called Smile Now. It's a little flexible rubbery template that has a peel and stick V surface. The teeth are dried, and then this template can be stuck right over the existing teeth. As with Visalis, I believe this is a must for every practice. So it's an instant dental template, comes in different sizes, 4 different sizes, 2 different shades. In the trial kit, you get 8 different templates. And in instant, you could measure the front tooth and insert a template to see a quick smile preview. Perfect for patient communication. Once again, you got to know where you're going to get there quickly. So here are a couple before and after smile previews with Smile Now in place. This would allow you to see where you're going, and then Visalis veneers are a wonderful adjunct to use for the final product. Once again, Smile Now before and after. Once again, Smile Now before and after. This was our 4th visualization tool. I like using this tool because I can see in size or length. The patient can see it in the mirror. I can see a profile nicely, and I can see this repose, lip at rest nicely. And I believe those are the keys as first steps in analyzing any smile. With this patient, you can see there's a huge diastema here. Honestly, looking at this patient and visualizing, I never thought that I would be able to achieve aesthetic results with bonding or veneers. But once I slipped a Smile Now template in, I was amazed how the face just seemed to fall right into some aesthetic guidelines. And I could preview the smile as well as the patient could preview the smile. This after isn't with the Smile Now in place. It actually is after the bonding was completed. So you can see Smile Now can help in many circumstances. If you're interested in this product, check the website out, www.yoursmilenow.com. Now let's go on and talk about building blocks of desired product characteristics when we're considering what our final product will be made out of. So I'm sure that I use building blocks. We all have goals for what our desired outcomes are going to be. And as I'm looking at my building blocks, the first desire for me is choosing a product that's very adaptable. I will tell you that ViSalus veneers are so adaptable, you're going to love them. You can use them in so many circumstances. They actually offer an appropriate flexibility with enamel. And what I mean by that is, unlike a porcelain veneer, a ViSalus veneer is not as brittle. It has more flexure strength that is equivalent to enamel than a natural porcelain would. So I love it because it's adaptable. It can be used in many situations. It's very biocompatible with the tooth. Once again, through flexure strength, through bondability, it bonds beautifully to enamel because its B surface, the inside surface, is primarily made of resin. And you'll see as we move forward how the product is manufactured and how these building blocks and desired characteristics of the product really enhance the end result. C, conservatism. I love this product because in so many situations I'm able to be very conservative. Unlike a porcelain veneer, in my hands when I'm prepping a porcelain veneer, typically to maintain aesthetics of the interdental spaces, I often go through the interproximal areas. But with these ViSalus veneers, very rarely am I opening my interproximals. I find this product to be very conservative. Much like what product can I say, for example? Much like a lumineer. This product is very conservative, but unlike a lumineer, this product is not brittle. So let me continue on. D, durability. I think you'll find that with this product, as in with my hands, the science really shows us the durability of this product because of its flexure strength, equivalent to that of enamel. It's going to not chip like a natural porcelain would, and it's going to, if it does chip, as you'll go on, you'll see some other benefits. Durability is wonderful with this product. The B surface is composite. As you bond it to the natural tooth, that B surface and rolling over to the tongue side allows natural wear because enamel and resin wear more equivalently. So I really like this product for its durability. Aesthetics. Aesthetics have been beautiful. I've been really amazed at the chameleon effect that we see from the aesthetics in this product. And having that A surface that's so strong, all ceramic or all glass, and is homogeneous, just provides a beautiful aesthetic end result. And finally, fixability. The beauty in this product, it is just very easy to repair, unlike a traditional porcelain veneer. So ViSalus veneer chairside, here's what the kit looks like. You can see that there are, for the maxillary arch, they come in 3 different sizes, small, medium, and large. For the mandibular arch, they come in 2 sizes, small and large. So for example, you would pick a front tooth, measure the size that fits like you saw in my previous photos, and select the appropriate tooth to begin bonding. Let's take a look, a new smile in 1 appointment. Like I said, there are so many instances that I can use it for. I can use it for simply aesthetics, like you saw in my first case. You'll see as we move forward, we can use it for orthodontics, for tooth size discrepancy, combination cases, and I'll show you what I mean by that, diastema fills, trauma, and replacement of old bonding. It's really simple. Teeth can be whiter, brighter, and more glamorous, and I really believe that ViSalus veneers should be part of your armamentarium. So let's look at some cases. Case number 1. Like I said, we're going to be filling some little diastemas in this case. I would have never, in the past, I maybe would have filled these spaces with some bonding, but you know, it's really always hard to make those seams invisible. Take a look at what I can do with the seams and how I can make these ViSalus veneers just look so natural. First of all, we take a measure using the measuring tool, and then I try my veneer in. You could see that in photo number 1 in the upper left, the veneer is a little long. I'm going to modify the veneer from an incisal gingival standpoint first with the high speed, and then I'm going to modify it on the B surface to thin it a little bit. So I'm not going right to the tooth, I'm thinning the veneer. Next, I reshape my natural tooth as needed for proper fit of my veneer, and I retract if needed. In this situation, I was placing 2 veneers, 2 ViSalus veneers, one on the cuspid and one on the lateral. So you see, I try in for proper fit and shade. I've chosen an A1 shade, and I'm going to use the bonding material in the ViSalus veneer kit. In the second picture you see here, to the right at the top, I have both of my veneers set in place. Now I'm going to use my micro etcher. I love to use my micro etcher. I use it every day, all the time. I prep the internal anatomy of the ViSalus veneer with my micro etcher. I rinse and then I add my adhesive, dispersing it with air and curing. Next, I prep my teeth. I micro etch, I add my adhesive, I disperse with air and cure. Then I start to place my veneer. First, I fill the veneer on the B surface with the desired composite. And then I begin placing the veneer setting the veneer into place. You can see I push it into place with my fingers, and then I remove the excess. I manage my contact and I cure. I begin polishing one at a time. I like placing these veneers one at a time. So I'm going to polish my distal contact of the lateral first. I'm going to clean up my margins with a diamond and with a blade. And then I'm going to polish with a carbide and move on to the next veneer. So you can see the first veneer is in place and I'm moving on to the next. Here's the before and after on the day that the veneers, ViSalus veneers, were placed. The diastema is closed and the patient's happy, and so am I. Case number 2, tooth size discrepancies in orthodontics. This 18-year-old lady had diastemas, and she was in the middle of ortho. I recommended that the orthodontist first position the teeth so that I could then come back while the patient was still in ortho and fill the diastemas. You can see here how I use the measuring tools. I measure with the Visalis measuring tool for size, and then I begin one tooth at a time. You can see the first tooth is in place. I reduce and modify the veneer, and then I reshape my tooth. I prefer to modify the veneer first because if something were to break with the veneer, I do not want to go to the tooth. I do want to be able to make sure I have a veneer to place before prepping the tooth. Then I begin to reshape the natural tooth as needed for proper fit of my Visalis veneers. I prepare the veneer with microetching. I add my adhesive and dispense with air. I prepare the veneer and cure. Now I'm ready to move to the tooth. I prepare the tooth, I microetch, I etch. I do make sure that the etch, especially in these situations, really comes to the lingual line angles. I prepare the tooth and apply my adhesive. I cure my adhesive. And now I can get ready to manage my interproximals. There are a number of ways to manage the interproximals. I can use Mylar. I can use plumber's tape. In this situation, I'm going to use my Mylar strips to manage my interproximals. I apply the composite to the B surface of the veneer, and I place the veneer on the tooth. Sometimes I use my finger to push the composite in. Other times I make sure with an instrument that the composite has filled the entire veneer. And once again, I insert the veneer, and I don't, typically when I'm placing two centrals, I make sure that I have both centrals in place before I begin curing. So you can see I can get these two centrals in place, confirm my midline, confirm my incisal edge and my cervical edge, and then cure. I remove my excess, run my Mylar strip through my contact, and I always run my Mylar strip to the lingual to pull that excess composite to the lingual. I cure my centrals, and once again I polish the distals, and I continue on. You can see with a case like this, this is an additive case. We're really bonding on enamel. And what we know about composite bonding is that when we are bonding composite to enamel, we've created the strongest bond possible. This is certainly a benefit to using these Visalis veneers. Visalis veneers were created through tool and die technology, and they were created at the University of Geneva in Switzerland. Rigorous research and development had gone on in Geneva for these Visalis veneers. They've been put through many thermal cycling tests for ice, coffee, tea, as well as compression testing. And these compression tests that they've run on the Visalis veneers have been equivalent to 1.5 million cycles of mastication, which translates to about 5 to 6 years of linear wear. So I'm really confident as I go through in this case and use this product on a patient like this 18-year-old, I'm really confident that I'm going to be able to adjust the bite. And these restorations are going to last this kid a long time, because what I know about all the research and development that's been done, not only have I offer this patient something that's really a porcelain veneer that has the A surface that won't discolor, won't take up water, but also it's inorganic on that A surface, and it's 90% porcelain on that A surface. That's what all the testing has shown us. We look at the properties of how this product was manufactured, and through the sintering process, the University of Geneva in Switzerland used a laser light and a plasma light to create these veneers. And the laser light functioned to coalesce and draw the glass particles to the A surface. And through looking at these under microscope, we found that the A surface is 90% glass and the B surface is resin. The plasma light tempered the surface. You know, like I said, they used laser light and plasma light. It rendered the A surface 90% glass and the B surface resin, which allows much better adhesion. So once again, when I'm looking at this gal, this 18-year-old gal, I think I've given her the best possible product that I can. And even if something were to fracture down the line, because of the fact that we have this monoblock of composite, we're able to adjust the bite, and these just polish beautifully. Actually, I'm able to bond to them quite nicely. So I continue moving on centrals to laterals, once again following over the lingual line angles to ensure that I'm going to get a nice bond around to the lingual. Following protocol with adhesion like we know to do. Inserting veneers one at a time. Once again, I'm going to run my mylar or my metal strip, whatever choice you want to make, whether it's mylar or metal, through the contacts, dragging that extra resin to the lingual and curing. Once again, tooth by tooth, reshaping to avoid any voids. And I continue. After insertion of all of the veneers are placed, I can then come to the margins and start to polish. I typically do place retraction on these cases so that I can really get a nice seal at the cervical. Now I can send this patient back to the orthodontist for the brackets to be placed back on. And the patient has been informed that once the brackets come off, we can even place these Visalis veneers on the premolars. So in this case, I have one happy teenager headed back to the orthodontist. You can see as we move forward, this is a technique that's great to manage closing diastemas. This material mimics the natural enamel of the teeth. It's very aesthetic and flexible. And once again, it's created that monoblock that we've talked about. Here's the tooling that I was telling you about. You can see that the graphics, including pressure, which caused the liquid material to be injected into the tool and die. And once the liquid has, the composite in its liquid form has been transferred into the die, a laser light is used to coalesce and draw the glass particles to the A surface. And through vitrification, the plasma light can now temper the surface to extract the remaining resin and render the A surface 90% glass. So this laser light and plasma light sintering process has been the key to creating this patented process that is used by these Visalis veneers to gain that beautiful A surface and that very bondable B surface, which offers us that flexibility that we need, as well as the bondability and monoblock that we need for strength. So I believe, once again, we're combining all of the best characteristics of aesthetics, function. Once again, all those A, B, C, D, E, F. And I really believe that when we're choosing products, why would you choose anything else? Especially in a youngster or in a repair situation, there are so many positive ways to use this product. This product, once again, is adaptable, it's biocompatible, it's conservative, it's durable, it's aesthetic, and also it's fixable. You can see the sintering process, which creates the coalescence. The plasma waves of the plasma light create the coalescence in rendering that, pulling that glass to the A surface. Once again, biocompatibility with flexure strength equivalent to enamel of approximately 17 to 19 megapascals. Durability, creating the monoblock that forms between the tooth, the resin, and the glass. You can see this homogeneous surface that's visualized. I'm a scanning electron microscope. This translates to very little staining and no water penetration. I can't believe the aesthetics. I've been amazed every time. The chameleon effect that exists is just beautiful. The A surface, once again, is 90% glass, but also because I believe, because of the composite nature, the thicker composite nature that the monoblock that's created, I really believe that the aesthetics and the chameleon effect is better than any porcelain veneer that I've seen. And this is a reason why I would choose this product in, for example, those laterals in the youngster that you saw at the beginning of the presentation, because it just seems to have a natural end result. And as I said, it's fixable. What do I mean by that? We can subtract from it. We can add to it. We can adjust it. So once I get these in, they're so easy to finesse the occlusion with, and also to fix if something were to fracture, or to fix, for example, I had a guy come in, and I'll show you as we move forward. He was in growth and development, and I had bonded the tooth and with one of these Veneers veneers. And 2 years later, or a year and a half later, because I placed it about a year and a half ago, like I said, I've been using the product for about a year and a half, Mom came in and said the tooth was too short. Well, of course, the teeth were continuing to develop into the arch and the bonding wasn't changing. So we were easily able to add to the incisal edge without a problem. Couldn't do that with a porcelain veneer, that's for sure. So let's go on. Case number 3, a combination case. And this has really been a great pleasure for me to add to my armamentarium, because as you look, this gal came in and she had one old crown on her front tooth and some old bonding. She was on a fixed budget and was not able to consider 4 veneers. But with this product, I was able to complete a combination case and get an exquisite end result. See how I do it. Managing color and translucency is the key. You can see under that old crown, she had an old post. But before I went to manage this, I placed Veneers veneers on these 3 teeth, 7, 9, and 10. And once 7, 9, and 10 were placed, I used those 7, 9, and 10 to create my labial profile and create all the little innuendos. And then I could go and let the lab technician mimic what I had done. So once my Veneers veneers were placed on this combination case, I went then ahead and completed covering the old post with an Emax coping and then completing a single unit crown. What a benefit for the patient, and what a money saver for her as well. You can notice the universal thickness of the Veneers veneers here. I think this is a great representation. And you can kind of even get a feel for the chameleon effect, how beautiful that incisal translucency is. I didn't really talk about color, but all the color of these come from within, from the composite shade that you use to, that you choose to place underneath. Just like we choose dentin shades, like we know the color of a tooth comes from within, comes from the dentin. Unlike a porcelain veneer, oftentimes with the porcelain veneer we're trying to hide color or change colors. We don't have any color in the Visalis veneer itself. It's very translucent. We're gaining all of our color through this monoblock of resin that we're placing underneath. And I believe that is an additional reason why these Visalis veneers are so beautiful. So let's look at a couple more cases. This is the case that, I don't know which case this is. I think this is the combination case that I modified the veneer and placed on the 3 adjacent teeth. Once again, I use retraction. And you could see this old crown in place, and I'm fitting these Visalis veneers on the adjacent teeth, trying it in, micro-etching, selecting my adhesive, placing my adhesive and curing, micro-etching the tooth, prepping, etching the tooth, placing my adhesive and curing, throw a little pic of my family in there. And this is one happy lady. I just can't tell you how I've been pleased to be able to use this, not only to save time and to save money. Case number 4. This patient was unhappy with his diastemas in the lower front and didn't want to prepare the teeth for crowns. I can understand. That seems a little drastic. I said, let's try these. So we begin with our size chart. This is what the packaging for the Visalis veneers looks like. You could see I chose a small Visalis veneer small. The next line you can see it says it's a lower tooth. It's tooth number 24. That's all you need. So you open this packet up and there's one tooth in this packet. I gain anesthesia. I pick my shade. Once again, this will be the composite that will provide the monoblock between the Visalis veneer and the tooth. I try my veneer on and modify it. I modify my tooth. I micro-etch my tooth, micro-etch my veneer, apply my adhesive, cure my adhesive, etch the teeth, place my retraction in my mylar, place my adhesive, cure my adhesive, place my second coat of adhesive, and now I'm ready for my composite. I'm applying my composite to the V surface of the Visalis veneer, and now I'm seating my veneer. Because of the big diastema in this situation, I elected not to place both at the same time. I wanted to be able to have access to that cervical embrasure to be able to smooth it nicely so as not to have a gingival problem at the end. So in this situation, unlike an 8 and 9 situation like you saw in a previous case, I elected to polish the interproximal before placing the adjacent tooth. Now I'm preparing the next veneer. I place some composite on the tooth and on the veneer, and I'm seating the veneer in place. You can see how I'm pushing it passively into place. Removing the excess bonding, running my mylar through to the lingual so as to create a nice seal of composite. And curing. This is the result the day of treatment. I don't have a follow-up, but if you come back to a seminar next time, I'm sure to have a follow-up for you so you can see the chameleon effect. But I think you get a pretty good idea. What a result. So conservative, so pretty, so fixable, so compatible with the environment. Just really a great service for our patients. Here's the boy that I talked about that I had come in with a broken tooth that the mom brought back just about 3 weeks ago. This is really a case that I think is great to see because it's conservative. This kid is going to need treatment in the future. And guess what? I'm able to bond to this. It's so hard to bond to a porcelain veneer and get a nice end result. But I'll tell you, bonding to this is just a dream. Once again, we follow the steps. Pick a veneer. Modify the veneer. In this situation, I just wanted to show you how I can bond. You see that I have this in place, but the previous picture was showing you that I was choosing some composite to set the tooth in place to confirm that A35 was the shade I wanted. And that's a nice thing to do because you can see in this fourth picture here how transparent these veneers are. The shade really is coming from the composite underneath. So in the beginning, it's nice to be able to, and even if you have question, it's nice to be able to try the composite in and get a shade check before you move forward. Retraction is placed, the tooth is modified, and we go through the same steps. So here's the before and after. And in our next presentation, I'll show you how I modified the tooth and how pretty it looks. Case number 6, some old bonding. This guy came in and you could see his one central incisor was old bonding. He has 3 kids at home, one of which is a newborn, and the last thing he has money for is a porcelain veneer. But with this product, I'm able to give him a porcelain veneer in one appointment. I measure using the measuring guide. I choose a veneer, and I choose a shade. You can see in this picture I have an A3 or an A35 that I'm deciding between. I try the A35 in place, and I set it on the tooth, just to get a feel for if this is the shade I want to use or not. And I'm pretty happy with that. I prep the tooth, I prep the veneer, and now I just follow all my steps again. Micro etching and etching using the adhesive that came in the kit on the veneer as well as in the mouth. And here's the A35 shade that comes with the ViSalus veneer kit. And once again, I place my veneer, pulling the mylar through to the lingual to get that nice seal of composite around that lingual line angle. And now I begin prepping. Now I begin just refining. The patient wanted a little diastema, and that's what he got. You can see how pretty the before and after are. That after result is just really exquisite. And it takes some of the pressure off because for me, I find that I spend, when I'm doing direct bonding, most of my time on customizing that labial surface. In a lot of instances, I find with these ViSalus veneers that I never even go back to the labial surface because the veneers have such a beautiful shape themselves. So what's our goal? Let's make more girls happy with Smile Now and ViSalus veneers. We want our smiles to change the world, don't we? We don't want we don't don't let the world change them. So let our smiles change the world. Don't let the world change them. I thank you for allowing me to present to you today this Kettenbach product.